Hello and welcome. Today we're diving into a complex and potentially serious lung disease, pulmonary vasculitis. We'll explore what it is, what causes it, how it affects the body, and what can be done about it. Whether you're a medical professional, a patient, or simply curious, this video aims to provide a comprehensive overview of pulmonary vasculitis. Pulmonary vasculitis isn't caused by a single, isolated factor. Instead, it's often linked to autoimmune disorders, where the body's immune system mistakenly attacks its own tissues. In many cases, the exact trigger remains unknown, but genetic predisposition, environmental factors like exposure to certain chemicals or infectious agents, and pre-existing autoimmune conditions are believed to play a role. A prime example is granulomatosis with polyangiitis, formerly known as Wegener's granulomatosis, which is strongly associated with the presence of anti-neutrophil cytoplasmic antibodies, or ANCA. At its core, pulmonary vasculitis involves inflammation of the blood vessels in the lungs. This inflammation narrows or even blocks these vessels, restricting blood flow and damaging lung tissue. The inflammatory process can lead to the formation of granulomas, which are clumps of immune cells, further contributing to tissue damage. Reduced blood flow to the alveoli, the tiny air sacs in the lungs, impairs oxygen exchange, leading to breathing difficulties. Over time, this can result in scarring, fibrosis, and a decline in lung function. Pulmonary vasculitis is considered a relatively rare disease, though its exact prevalence is difficult to determine. Certain types, like granulomatosis with polyangiitis, are more common in individuals of Northern European descent. The disease can affect people of all ages, but it typically presents in middle adulthood. It's important to remember that while rare, early diagnosis and treatment are crucial for managing the condition and preventing serious complications. The signs and symptoms of pulmonary vasculitis can vary depending on the severity and specific type of vasculitis. Common symptoms include shortness of breath, coughing, sometimes with blood, chest pain, and fatigue. Because the inflammation can impact the kidneys or other organs, patients might also experience fever, weight loss, joint pain, skin rashes, sinus infections, or kidney problems. The symptoms can develop gradually or appear suddenly, making it vital to seek medical attention if you experience any persistent or concerning respiratory issues. Diagnosing pulmonary vasculitis can be challenging, as its symptoms often overlap with other lung conditions. A thorough medical history, physical examination, and a battery of diagnostic tests are usually required. Blood tests, including ANCA testing, can help identify specific antibodies associated with certain types of vasculitis. Imaging studies, such as chest X-rays and CT scans, can reveal abnormalities in the lungs like nodules or areas of inflammation. In many cases, a lung biopsy is necessary to confirm the diagnosis by examining lung tissue under a microscope. Pulmonary vasculitis encompasses a range of related conditions, with granulomatosis with polyangiitis being one of the most well-known. Other types include microscopic polyangiitis, eosinophilic granulomatosis with polyangiitis, formerly known as Churg-Strauss syndrome, and vasculitis associated with systemic lupus erythematosus or rheumatoid arthritis. Each type has unique characteristics, diagnostic criteria, and treatment approaches. The primary goal of treatment is to suppress the inflammation and prevent further damage to the lungs and other organs. Immunosuppressant medications, such as corticosteroids like prednisone and cytotoxic agents like cyclophosphamide or rituximab, are often the cornerstone of treatment. These medications work by dampening the immune system's overactive response. In some cases, plasmid exchange, also known as plasmapheresis, may be used to remove harmful antibodies from the blood. Ongoing monitoring and supportive care, including oxygen therapy and pulmonary rehabilitation, are also essential. Unfortunately, there's no known way to definitively prevent pulmonary vasculitis, especially when it's linked to autoimmune disorders. However, avoiding known triggers, such as exposure to certain environmental toxins or infectious agents, may reduce the risk in some individuals. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can support overall immune function. For individuals with pre-existing autoimmune conditions, close monitoring and management of their underlying disease may help prevent the development of vasculitis. The prognosis for pulmonary vasculitis varies depending on the specific type, severity, and how quickly treatment is initiated. With early diagnosis and aggressive treatment, many patients can achieve remission and lead relatively normal lives. However, relapses can occur, requiring ongoing monitoring and adjustments to treatment. Recent research has focused on developing more targeted therapies with fewer side effects. Studies are exploring the role of specific immune cells and molecules in the pathogenesis of vasculitis, paving the way for novel treatment strategies. The exploration of personalized medicine approaches, tailoring treatment to an individual's unique genetic and immunological profile, holds promise for improving outcomes in the future. As our understanding of pulmonary vasculitis deepens, so does our ability to provide better care and improve the quality of life for those affected by this challenging disease.